When Michael Jackson died, an autopsy was ordered. When Anna Nicole Smith died in South Florida, an autopsy was conducted. When someone dies under suspicious circumstances such as a crime, or when a person dies suddenly or under other unusual conditions, autopsies are required by law in Florida. But when most people die, an autopsy is not done. An examination of records by the Scripps Howard News Service found that in Florida, autopsies are performed on about only 10% of all deaths, which is in line with the national average.
An autopsy is being done for the living, is what we say. The results are going to have implications for those of us that are still alive.
Michael Doberson is a coroner in Colorado. He's in favor of conducting more autopsies. He says the decline in autopsies in the last half-century is resulting in a loss of medical information.
It was also found at that time that an autopsy was able to pick out, in at least 40% of the cases, a significant medical condition that was not known prior to the patient's death.
Due to costs, liability issues, and a lack of pathologists, fewer autopsies are being done today. Some say because the exact cause of death is not being properly determined, money for medical research is not being spent in the right fields.
Well, this information is used for the development of health interventions, for the setting of health priorities. It's used in research on various causes of death. If we get this information wrong, then we're likely to misallocate resources. We're likely to develop health interventions that aren't really evidence-based.
One study by the Agency for Healthcare Research and Quality found the causes of death were wrong about 30% of the time for major diseases such as heart attack, breast cancer, pneumonia, and stroke. But News Channel 5 health expert Dr. David Soria, who is Chief of Emergency Medicine at Wellington Regional Medical Center, disagrees.
Yes, although there isn't a lot of time and resources spent in determining the exact cause of death, i.e. an autopsy, because the resources spent or that are necessary to do that are not a good allocation of time, money, and or the use of physicians' expertise.
The cost of an autopsy averages about $3,000. If an individual wants an autopsy on a family member, a private pathologist can be hired. Vince Norman, WPTV, News Channel 5.